This is our Everyone Matters conference, which is very much about getting all our support workers together, our bands 1 to 4, in a room to just share lots of really good experiences and to look at some real important burning issues within the Trust, particularly issues such as quality and patient safety.
The idea for the conference came about from us wanting to do something for our support workers. They make up 40% of our workforce, but yet often don't have time to get together as a group of people. They also spend most of their time with our patients, and it was really important for us that they felt valued.
It's about everyone, the patient-facing staff, the people that are sort of on the coalface, so to speak, doing the work, have just as much an important job and a voice as anyone else.
The title of today's conference is Everyone Matters, and in my mind that has at least two meanings. Everyone matters. Every one of the people that we serve, every single person that walks through our doors to receive services matters. They come to us when they're ill, when they're worried, maybe they're in pain, and the service that they receive from us really counts every single time. And the other meaning it has for me is everyone matters in terms of every single person who works in this organisation, who is a colleague in this organisation, matters. Doesn't matter whether you're a medic or a domestic, whether you're a nurse or a nursery nurse, all of us really count in terms of working together as one big team to deliver the very best thing that we can for the people of Gloucestershire.
We were lucky enough to receive a grant from West of England Academic Health Science Network to provide some human factors training, including SBAR. Poor communication often contributes to incidents. SBAR is a structured communication tool enabling us to relay important information. SBAR stands for Situation, Background, Assessment, Recommendation. It allows staff to communicate assertively and effectively, reducing the need for repetition.
If we go into a team and we're happy, and we communicate well, and we try and work well as a team, life should be a little bit more straightforward, a little bit easier. And when we have it easier, our patients get safer care.
Caring for a loved one, especially when they're dying, is a very hard thing to do. The network of support helped make those final weeks more bearable for both of us. I felt that my husband was treated holistically, not just medically. The wants and the needs of the patient were paramount. People listened to what he wanted and worked to achieve it. Nothing was ever too much trouble. Each and every one, whether medical, admin, domestics, porters, regardless of their grade, played their part in getting my husband through whatever problem he was having at that time. They made a difference. You are all part of that bigger team. You too can have an impact on someone's life and make a difference.
Communication and teamwork plays a really important part with patient safety. Human factors is the way that we're feeling when we come to work. It's being aware of our stress levels and our resilience, and it incorporates leadership and team working.
When I visited him in hospital, he would be telling me what the doctor had said that day. Then suddenly he would lower his voice and say, "See that porter over there? He's a nice bloke. He took me for an x-ray this morning. Turns out he's a big Cheltenham Town fan. We had a great chat about football." Or, "This lady bringing round the tea trolley, she's smashing. Always got a smile on her face and a cheery word. Makes my tea just as I like it." That lady who does the cleaning, she's a member of the National Trust. We've been comparing notes this morning about our favourite places. These were the people that made a difference to his mood. When you're in hospital, you don't need reminding that you're ill, that's why you're there. You want some contact with the outside world. You want to feel normal. Never underestimate the impact that you can have on a patient just by a smile, a friendly word, a brief chat about ordinary things.
If you're in one of our community hospitals, yes, it matters that we have skilled nurses and therapists there. But actually, during that long day, it's whether the room is clean, it's whether the room is warm, it's whether you get hot meals that are nice food, whether you get regular hot drinks, whether there's somebody there's a friendly face to talk to. All of that really counts, and it's what you do. And the same in our clinics. You know, if people are coming to a clinic or an outpatient appointment or something, it's often because they're worried. So it really matters that the person that they speak to on the phone is friendly, that the person on the reception desk is welcoming, that they get good information in a welcoming waiting room and that sort of thing. So again, it's what you're doing every day that really makes a difference to people's experience.
During the afternoon we ran some workshops. One of these was a patient perspectives workshop, so staff had an opportunity to understand how it feels to be in a patient's shoes.
Over this side of the room we've got age suits, so things that are going to splint your joints so you can see how difficult it is to function normally. And round the corner we've got a video to watch, and we've got sort of ear defenders so we can change your perception of what you can hear, and we've got all sorts of goggles so you can see what it's like to have impaired eyesight.
I've learnt a lot about patient experiences, especially from the talks we had this morning, which were very emotional and very inspiring too. And the workshop time has been valuable as well to share some of our best practices.
Gave me an insight to actually how they feel and how good the service is.
It actually does remind you how difficult it is for the patients and give people more time. You can't give people too much time.
It's been a really good day. I've really enjoyed myself. It's been really nice meeting new colleagues, having the opportunity to step back from work and have a day that just makes us feel valued as a workforce, and to have some input to our development.
I just want you to know that you are so hugely valued within the Trust for what you do, and I don't need to say that the people who use our services hugely value what you do every day, so a really big thank you. We don't often get the chance to say thank you, but thank you.